If you're living with tinnitus, that ringing, buzzing, or static in your ears that never quite stop, someone might have told you you should try hearing aids, they help. And you might have wondered, why would I want things louder when my problem is already too much noise? That's a fair question, and honestly, if you've ever felt dismissed or frustrated like no one really gets what it's like to live with tinnitus, you're not alone. Most people, even professionals, don't explain it very well. I'm Dr. Layne Garrett, and I'm the founder of Timpanogos Hearing Tinnitus in Utah. In this video, I want to give you two things. First, a clear explanation of why hearing aids help so many tinnitus sufferers and why they're not the whole solution. And then also my top 3 hearing aid picks for tinnitus in 2025 based on real world results, not just fancy features. Whether your tinnitus just started or you've had it for 10 or more years, this is for you if you're ready to stop guessing and start using a real plan. Let's start with breaking down the why. Here's what we now understand. Tinnitus is not just an ear issue, it's a brain issue. For most people with tinnitus, there's also some degree of hearing loss, especially in those higher frequencies. When those sounds go missing, the brain doesn't like that silence. It starts creating sounds to fill in the gaps. That's what you hear as ringing or buzzing. Hearing aids interrupt this pattern in 3 key ways. First, they restore the sounds you've been missing, which calms the brain. Second, they mask the tinnitus using soft, soothing sounds built into the hearing device. And 3, they reduce the mental effort to try to understand speech that lowers stress, and stress is a major tinnitus trigger. Now let's look at 3 hearing aids that are delivering the best tinnitus relief in 2025 based on clinical features and what I've seen help real people in my clinic. First up, the Oticon Intent. Oticon's strength is realism. Their philosophy, called brain hearing, is all about giving your brain the most natural, complete sound picture possible. And the new Intent hearing aid uses artificial intelligence to bring back those high-frequency details, a huge deal for tinnitus relief. Why? Because most people with tinnitus have that high-frequency hearing loss, and those missing sounds are what the brain's been trying to fill in. What else stands out about this hearing aid? Well, it has tinnitus sound support. It offers white noise, pink noise, and ocean waves, and more. You can also store multiple sound therapy programs in the hearing device and switch on the fly using the Oticon Companion app. Plus, Open Sound Optimizer prevents feedback without killing sound quality. This is best for people who want natural, effortless hearing with smart tinnitus control that they can personalize. The second device that we recommend for our tinnitus patients is the Widex Smart Rick. Widex has been known as the go-to brand for tinnitus care for a long time, and the Smart Rec is basically their Zen master. Instead of using the usual white noise or pink noise and static, Widex uses something called fractal tones, random melodic chimes that gently shift so your brain doesn't tune them out. These tones help the nervous system relax, breaking that loop between stress and tinnitus. Additional strengths with this hearing aid: improved microphone angles for better clarity in conversation, and the Widex Zen app offers guided relaxation, breathing exercises, and sleep sounds to help with your tinnitus. The Smart Rick is ideal for people whose tinnitus gets worse with stress or anxiety and want a more meditative solution. The third device that we see a lot of success with tinnitus patients is the Phonak Infinio Sphere. Is designed for people who want clear communication and powerful tinnitus tools. The secret is their new Deep Sonic artificial intelligence chip that helps you follow conversations in noisy places, and that's a huge win if social situations make your tinnitus worse. It also includes something called Tinnitus Balance, a customized masker tailored to your specific tinnitus pitch. It has universal Bluetooth streaming for sound therapy, music, or podcasts directly to your ears. The Phonak Infinio Sphere is best for very socially active people who want cutting-edge hearing and clarity and tinnitus relief. But here's the truth. Hearing aids alone aren't a cure, and anyone who tells you they are is skipping the hard part. Tinnitus relief happens when hearing aids are part of a complete treatment plan that supports your hearing, your brain, and your lifestyle. That plan often does include hearing aids, but it also includes things like sound therapy, tinnitus counseling, stress management, sleep and lifestyle modifications, and sometimes bimodal neuromodulation with a device called Lenire. And this isn't just theory. In a study published in April 2025 in Nature Communications, 91% of patients who used hearing aids combined with Lenire reported significant tinnitus improvement. That's the most promising data we've seen so far, and it confirms what we see in our clinic every day. When the brain is retrained the right way, tinnitus relief is possible. Let me tell you about a patient named Steve. He's 51, he works at a car dealership, and he came to us worn down by years of tinnitus. He told me the hardest part wasn't the sound itself, it was how it was stealing his focus, his sleep, and his peace of mind. He tried all the quick fixes, nutritional supplements, white noise machines, meditation apps, but nothing lasted. What worked? A full layered treatment plan. We diagnosed a mild to moderate high frequency hearing loss and then fit him with the right hearing aids for his hearing and tinnitus needs. We activated a tinnitus program in his hearing aids that provided a soft, calming masking sound for when his tinnitus was extra loud. He followed our My Tinnitus Therapy program, which uses cognitive behavioral strategies to change his response to the tinnitus. We helped him adjust his sleep and screen time routines, and later we introduced Lenire. 6 months in, Steve says, I still have tinnitus, but he told me something even more powerful. I don't notice it anymore, unless I go looking for it. He said he was sleeping. He was following his conversations again. And his wife said, I'm thrilled the TV isn't blasting me out anymore. Most importantly, Steve didn't feel helpless. He was back in control. Here's what I want you to take away. Tinnitus isn't something you have to live with, but treating it takes more than just a hearing aid. You're going to need a trained tinnitus specialist, a personalized hearing and tinnitus profile, a treatment plan that evolves as your brain adapts with the tinnitus. That's the difference between trial and error and real tinnitus relief. If you found this video helpful, please give it a like and subscribe to our channel so you can learn more about hearing and tinnitus relief. Remember, you don't have to figure this out alone, and you don't have to white-knuckle your way through tinnitus. Relief truly is possible.